10 tips for better life expectancy. Recommendations for increasing life expectancy in people with diabetes are similar to management and prevention tips. 1. Eating healthfully. A person should limit the consumption of foods that contain simple sugars, such as juices and candies, as these can cause blood sugar spikes. Also, it is better to eat complex, rather than simple, carbohydrates. These are in whole grains and legumes, for example. People should also limit their alcohol intake. A doctor will advise on diet and alcohol consumption. 2. Exercising. The Office of Disease Prevention and Health Promotion recommend that adults get at least 150 to 300 minutes trusted source of moderately intense aerobic exercise each week, such as brisk walking or dancing. 3. Losing weight. In people with excess weight, losing 5 to 10% can significantly reduce the impact of diabetes. 4. Monitoring and treating blood sugar levels. Tracking these levels allows a person to identify peaks, and they can then address the cause. Also, medications such as metformin can help stabilize blood sugar levels, but only if a person takes them as the doctor prescribes. 5. Following the treatment plan. This includes attending regular screenings and following the doctor's instructions about lifestyle strategies and medications. Blood glucose monitoring kits are available for purchase online. 6. Managing cardiovascular risks. Many health conditions can increase the effects of diabetes, such as kidney and heart disease, high blood pressure, and high cholesterol. Cardiovascular disease is the main cause of death among people with diabetes. For people with atherosclerosis and cardiovascular disease and type 2 diabetes, 2018 guidelines recommend that doctors prescribe medications for these issues as part of an overall diabetes treatment plan. 7. Preventing infections. Person washing their hands with soap. Share on Pinterest. Regular hand washing can reduce the risk of infections. People with diabetes have a higher risk of developing infections, such as influenza, pneumonia, and urinary tract infections. An infection that is relatively minor in a person without diabetes can become life-threatening in a person with the disease. Also, skin wounds can take longer to heal, and if they become ulcerated, amputation may be necessary. This can reduce a person's life expectancy, according to the research charity Diabetes UK. To prevent these complications, practice good hygiene, including hand washing. Get routine vaccinations to protect against the flu and other illnesses. Check the feet and the rest of the body regularly for wounds that may need attention. Seek medical help early for infections, including chest infections. 8. Reducing stress. Stress stimulates the release of hormones that can raise blood sugar and interfere with insulin regulation. Yoga, meditation, and speaking with a mental health professional or counselor can help combat stress. 9. Other healthful lifestyle choices. These include getting enough sleep and refraining from smoking. 10. Learning about diabetes. A 2016 meta-analysis that included data from over 13,000 people found that those who engaged in self-management diabetes plans appeared to have longer life expectancies than those who did not. Learning about the condition can equip people to manage their diabetes more effectively than if they are solely dependent on their healthcare provider. In a self-management education program, a person learns the skills they need to manage their condition. This can improve quality of life, reduce costs, and reduce the risk of complications, according to the Centers for Disease Control and Prevention (CDC) trusted source. Anyone interested should ask a doctor about programs in their area.